on the remote patient monitoring program for a year, and we want to see how they do. And we want to compare their average of their most 7 recent measures to those at baseline. So in the primary care group, we had 567 patients. And to put things into perspective, if you lower systolic blood pressure by 5 points, about what a typical medicine might do, you can expect a 10% lowering of cardiovascular, events, disease risk-related events. And that's a really big deal because not only is cardiovascular disease like heart attacks and strokes and heart failure, not only is it one of the major causes of mortality or the major cause of mortality, but it is also the major cause of disability in this country. So it has an amazing toll on the individuals who are suffering from these chronic conditions and their families and their quality of life. And it's also very expensive for the healthcare system. So what we found, because 5 points would be good, we actually found a 15.6 millimeter mercury drop in the patients from primary care. And that's great. And these were 567 patients. So now we wanted to see if the patients from the federally qualified health centers who'd been on the program for at least a year doing remote patient monitoring and comparing their first 7 data transmissions to their most recent 7 data transmissions, if they would do as well. And what we found is their systolic pressure went down by 17.6. So not only did they do as well, but they actually had a greater magnitude of improvement. Now, the level of statistical significance here was p less than 0.0001 compared to baseline, which means there's a less than 1/10,000 chance statistically that this was just some coincidence. We also saw really incredible improvements in that lower number, a diastolic number, whereas the primary care patients dropped that by about 9 points. And the FQHC patients that had a higher baseline diastolic pressure, they lowered theirs by 10.5 points. So what's exciting is that this shows that this could be a nice adjunct therapy for managing hypertension in patients that lack healthcare access. This allows us to bring this concierge-style care to patients no matter where they are, no matter what their zip code, helps bridge that gap that exists in healthcare equity, and can be the future of healthcare because these patients seem to respond really well to it. So very exciting stuff.